I've got two more guests on right now this morning. One who I'm always excited to have on. I'm not sure why she doesn't just call every month and say, let's talk about something. It's none other than Dr. Ngozi Ezike, who's the president and CEO of Sinai Chicago. Dr. Ezike, good morning and welcome back to WVON.
Good morning. Happy Monday. I'm so glad to be back.
Well, if you were that glad, Dr. Ezike, you'd call me more frequently. We wouldn't have to be waiting all these times to do this.
You are not calling me out on a Monday morning. Come on now.
I just did. It's too late. I just did. You know, you got information that we need, and I got to go through all this stuff to talk to Dr. Ezike. But we're always glad to have you, and thank you so much for being here, particularly to talk about this important thing, breast cancer. Joining us as well is Faith Eatman, who is a breast cancer survivor. Faith, good morning and welcome to WVON.
Oh, good morning. Good morning, Rufus. I just want to clarify, I'm not a breast cancer survivor.
You have
I'm a breast cancer advocate. I have a mom who's a 15-year breast cancer survivor, and I want more of us to be breast cancer survivors, and so that's why I'm here.
And this is why Rufus should not go from memory, but he should read his notes. Because my notes clearly say that you are an advocate here, and you got some things and some work coming in that way. I think as we go through life, unfortunately, Dr. Ezike, breast cancer is so prevalent that many of us are becoming advocates, whether we intend to be or not, just because we have so many friends, so many loved ones, so many family who are dealing with this, with breast cancer.
No, for sure. I mean, we know that 1 in 8 women will be diagnosed. So it is absolutely one of the most prevalent cancers that we have, but that's not the end of the story, because the story is that it's also one of the most treatable. It's one that we have so many survivors now. In fact, we have over 4 million people in the U.S. that are saying that they are women who have survived breast cancer. So that C word for breast cancer, that is not a death sentence. And so we want to understand that you can survive this. There are things we need to do. Obviously, this is why October is the time for Breast Cancer Awareness Month, that we need to get those mammograms and do those screenings so that we can identify this treatable cancer early so we can keep increasing those numbers of survivors.
Well, you mentioned that, and we do know so many more people who are survivors. It's not the same scarlet letter that it once was, but it is something that can be overcome. What is it? And really, Dr. Ezike, given all these things, why is it that we still hear of people who die from breast cancer?
Well, when we look specifically at our community, as great as the survival rate is, we do still see differences in the death rate. We do see that Black women, we are dying at a higher rate than our white female counterparts, whether just overall. It's even worse if you look at women under 50. I think if women are under 50, those Black women have a death rate that's 2 times higher than white women at that same age. And so that's where we need to get more answers, and we need to dig in to get at that nagging disparity. And so a piece of that is doing research. Traditionally, we have not been included in research to study, cancer, study the treatments. And so we really need to get more involved and be a part of the research so that we can better understand these diseases, understand how maybe there are culturally competent and effective interventions that will make sure that those disparities are narrowed and we don't have to lose our sisters to a disease at a higher rate than our white counterparts.
Indeed. Faith, come on into the conversation. What brought you this far to be such an advocate for breast cancer awareness?
Yeah, thank you, Rufus. Just listening to those statistics is interesting because, as I said, on one hand, my mother was a part of the over 4 million who's a survivor, is a breast cancer survivor. On the other hand, most recently in January of this year, I lost my best friend who is under the age of 50 to breast cancer. And so that's really what led me to this work and to the Voices of Black Women, to be an ambassador for the Voices of Black Women study led by the American Cancer Society, because as Dr. Ezike said, we need answers. My best friend, Ravi, who I lost in January of this year, was the person who told me about the Voices of Black Women study. And I think I really feel strongly that she should still be here, and that she just had a mistrust of the healthcare system, and she didn't feel like she was able to use her voice, or that her voice was being heard throughout her treatment process. And so I think that's why getting Black women to use our voices, to be involved in studies that are trying to solve this problem for us, is so important. And that's why I'm here this morning.
Can you both individually talk about why there is such a distrust still of the healthcare system and how we're going to get beyond it? What are your thoughts, Faith?
So, we know the history, right? And I would say, even though in some ways we're not included in research, and we are intentionally, systemically excluded, we've had things taken from us. When we look at Black women and healthcare research, the history of obstetrics, our bodies were experimented on without our permission to advance medicine. We look at Henrietta Lacks, who had her cells taken without her consent. That's still being used in medicine today. There is a history of things being taken from us to benefit others, but not benefiting ourselves, especially and even in healthcare. And I think that is something, that distrust is real, it's valid, because these systems were not created for us. They were not created to give us the same outcomes and equitable outcomes.
Dr. Ezike, your presence helps us get beyond this, but what can we do to get beyond this mistrust of the health system?
I think we need to stand together and demand answers. And in order to demand answers to some of these questions of these, outrageous disparities, we have to get involved. We know the history. It has not been fair or kind to us. But what we need to do in our future is demand answers by participating in the research. And that's why we want to partner with the American Cancer Society and be a part of the Voices of Black Women study, which is looking for women ages 25 to 55 who haven't been diagnosed with cancer to get information. So I really think moving forward, we want to be in that research. We want to be counted. We want to have our stories, matter and be studied so that we can really get the answers that we need and save those lives. I'm so sorry, Ms. Faith, for your friend that, you lost this year. Yeah. We don't want that to continue. We want the statistics of survivors to grow, not cases that we feel should have been saved that weren't. And so participating in that research is what we really need to do. And I'm so grateful for this groundbreaking initiative led by the American Cancer Society. We need to change that generational curse of being excluded from important health research, and we need to be a part of that research as a way to improve cancer outcomes for us.
Indeed, the Voices of Black Women study. We'll talk more about that with Dr. Ezike, with Faith Eatman when we come back right after this. Welcome back. Here are the facts. The number of female breast cancer survivors is projected to reach 5.3 million by January 1st of 2035. The differences in death rates are not explained by Black women having more aggressive cancers. Health systems need to take a hard look at how they are caring differently for Black women. Black women still have a 4% lower incidence rate of breast cancer than white women, but a 40% higher breast cancer death rate. Breast cancer is the second leading cause of cancer death after lung cancer in women in the United States, but it's the leading cause of cancer death in Black women. And Black women younger than age 50 had a death rate that was twice as high as white women that age. Plus, Black women are more likely than white women to die of breast cancer at any age. So what's happening? The American Cancer Society has a program called Voices of Black Women, which is trying to work through this. And Dr. Ike, if you would, walk us through exactly what Voices of Black Women is and how we can get more Black women involved in the work that's being done here.
Yeah, it's a wonderful, groundbreaking initiative by the American Cancer Society. And just in general, any cancer questions that you have, very wonderful website, cancer.org, very simple to remember. But the American Cancer Society has this Voices of Black Women study, and we need to get at those answers. And so to get at those answers, we need Black women to sign up. It's very simple to join in. You just go to the Voices website. It's voices, voices.cancer.org. And you can just click on, join us today. If you're 25 to 55 and you haven't had cancer, we want to start getting information. And even if you're not in that age range or you have had cancer, please tell someone who does qualify so that they can be part of shaping our healthier future for Black women.
Now, when we think about this, and Faith, you've lost two people who would be not lost, but have been impacted by two people who are critical in this space. Thinking about your mom, think about your best friend. When people think about the experiences that you had and watching them deal with this issue, why is it so important that we make sure that everybody knows and all of our sisters are involved in this study?
Yeah, I mean, I think Dr. Ezike has said it, but we understand what's going on right now. There's some crazy things going on in our country right now, as well as in healthcare, where our history is being erased and reimagined, and people are not getting access to the things that they need. So, we as a people, as Black women, we stand up, we use our voices for a lot of people. We put our voices behind a lot of things. And we're out here dying, literally dying. And so it's time for us to put our voices behind something that also it impacts us greatly because we're being silenced. We're being silenced in the workplace. We're being silenced, as I say, with our history. And this study, it can be our megaphone. It can be our way to stand up and use our voices loudly, collectively, to shift the conversation so that we are able to shift our future for the next generations, for generations and generations to come. And I just wanted to add to what Dr. Ezike said about this study and why it's so groundbreaking. It's being led by us, right? It's being led by Black women, scientists, physicians, researchers. I've met some of the Black women researchers who are working on these young, phenomenal Black women. This is something that is being led by us, for us, and it's just so important to be a part of this history so that it cannot be erased, so it can't be reimagined, and so that we are still here.
Well, Dr. Ezike, you gave us cancer.org for any questions that people may have about cancer, but there's a specific place that you go to engage with Voices of Black Women. What is that?
Yes, please go to Voices, VOICES, voices.cancer.org. It takes less than 5 minutes to sign up. And again, this is a critical first step to reshaping a healthier future for all Black women.
Dr. Ezike, while I have you, I spent some time on Friday talking with Tasia and Whiskey, who runs a Loretto hospital. And we talked about safety net hospitals and the challenges that they have there under any circumstance. You're running the Sinai health system, and we've got this shutdown in Washington with the push to really try and get some equity, get to someplace with providing better health access for everyone, which certainly includes us well into that number. Can you talk about what all this means to our hospitals, such as the ones that you are responsible for?
Yeah, my partner, Tesa, and all the people who lead safety net hospitals, we're literally doing some of the most important work taking care of communities that already have the worst outcomes and trying to reverse that trend. But we're trying to reverse that trend on funds not equivalent to what other health systems have, just by the nature of the Medicaid insurance or complete lack of insurance by our patient population. And so we really need to highlight, lift up our safety net hospitals. We are the infrastructure that allows the other health systems to actually do what they do. But we need to be supported to be able to serve our communities. And I would argue that given just the generations of disinvestment and not having adequate access to health care, we need more resources, not less, to care for our communities and to overcome these great gaps. And so I just want all people to think about the plight of the safety net hospitals and think about how important our work is and how important our communities are. You know, health is wealth. If you don't have health, it's hard to see yourself as a productive member of the classroom, of the workforce, of any place. And so we want to have these safety net hospitals be strong, to be able to partner with, primary care clinics, the federally qualified health centers, to actually uplift the health of people. But that starts with funding, appropriate funding.
Indeed. And for all listening, go wherever you go, on your phone, on your laptop, on your iPad. Go to voices.cancer.org, calling for women, Black women, ages 25 to 55, particularly if you've never been diagnosed with cancer. Use your voice to change the future of cancer as we know it. Dr. Ezike, always a pleasure to talk to you. You're always welcome back. Anytime you call, we're going to take it.
I'll be back.
I know you will, even if I have to drive over there and get you. But thank you so much, because we all absolutely appreciate you. And Faith, so sorry for your loss, but thank you for the advocacy that you're doing and the work you're doing here, and glad that you were able to come on with us this morning and share your thoughts.
Thank you so much. Thank you.
Be well.